and welcome back to the Curious Kid podcast. We are really lucky to have a special guest that will answer a few questions for us in just a couple of minutes. Also, please stick around until the very end of the episode for a big announcement. Olivia, tell everyone what we're getting curious about this week.
This week we are getting curious about autism.
I'm so excited to learn more about autism. Autism affects lots of people worldwide, so chances are that many of our listeners know someone with autism. What's the question of the week?
The question of the week is, who is Satoshi Tajiri?
Okay, while you're thinking about who Satoshi Tajiri is, let's start learning more about autism. About 1% of people worldwide have autism. That means that about 1 out of every 100 people in the entire world have autism. In the United States, it's even more common than that. In the US, 1 out of every 54 children are autistic.
It's more common in boys than girls.
That's true. Boys are 4 times more likely to have autism than girls.
The number of people with autism is increasing.
So here are the numbers in the United States. 20 years ago, 1 out of every 150 children were autistic. And 10 years ago, 1 out of every 68 children were autistic. As we said a minute ago, this year, the number of autistic children is 1 out of every 54. That's a very quick increase.
Why are there more kids with autism now than there were a few years ago?
So, it's not quite clear why this is happening. Many people believe that it's one of 2 things. The first is that people are more aware today of what to look for in children as potential signs that the child may be autistic. In other words, it's possible that lots of people had autism many years ago, but it was just never identified as autism. Another theory is that the numbers are actually going up very quickly because of different environmental risk factors, such as toxic chemicals like pesticides that are used to kill insects.
One thing we know for sure, vaccines don't cause autism.
You are absolutely right. Back in 1998, a doctor said that the MMR vaccine can cause autism. It turns out he was very wrong. But because of what he said, many parents stopped vaccinating their children. Time and time again, different studies have proven that there is no link between the MMR vaccine and autism, and never has been. Even after no link was proven between the MMR vaccine and autism, people became concerned that an ingredient in some vaccines, called thimerosal, might cause autism. As was the case with the MMR vaccine, it's been proven that thimerosal does not cause autism. In fact, thimerosal was removed from vaccines in the United States in the year 2001, and the number of people with autism has only continued to go up.
What causes autism?
We aren't certain what causes autism, but we do know that genetics play a big role in autism. If you have a sibling with autism, you are more likely to have it yourself. If the sibling is a non-identical twin, the risk increases even more. If the sibling is an identical twin, the risk is even bigger.
What is autism like?
That's a great question. People are different in so many ways. Some of those differences are easy to see, like hair color. But some of those differences are harder to see.
For example, you can't tell by looking at me that I'm scared of bees.
Right. Well, it turns out that just like people see each of us differently, people also see the world very differently, although you wouldn't know it just by looking at them.
My daddy sees bees and he's not scared, but when I see bees, I'm scared.
Exactly. We see things differently. And that's because each of our brains work a bit differently. Our brains are like the computers that control who we are. Scientists have discovered that the wiring in an autistic brain is a bit different. Our brain helps determine how we learn things, it helps control our emotions, and it helps us communicate.
Children with autism have trouble communicating with others.
Almost half of the children with autism don't speak at all. Some autistic children might not do certain things other kids do all the time, like smiling, waving, or hugging.
Autism might also change the way you sense things.
So there might be a sound, or a smell, or a sight that is completely normal and harmless that upsets someone with autism. This is called sensory sensitivity.
Autism might lead to repetitive behaviors.
That means that autistic children will often repeat doing the same things over and over again as a way to settle themselves.
How early could you tell that someone has autism?
Parents might be able to suspect that something is not right very early, like if their baby doesn't do things like play with their toys or make eye contact. The signs we discussed, like difficulty communicating, sensory sensitivity, and repetitive behaviors, usually don't appear until about 2 years old, and many kids don't get medical confirmation that they have autism until they are 4 or 5.
Autism has nothing to do with intelligence.
That's important to remember. There is a number called an IQ number, and IQ stands for intelligence quotient. That's a number that's supposed to calculate how smart somebody is. The higher the number, the more intelligent. The lower it is, less intelligent. More people with autism have above average IQs than below average IQs.
People with autism might have a hard time doing something we think is easy, or they might be really good at something we think is very hard.
An autistic person might have trouble making friends because they have difficulty communicating. But many autistic people have amazing talents, like an incredible understanding of math, or they might find playing the violin simple where a lot of us would find it hard. Thankfully, we have a special guest that is going to help us learn so much more about autism. Her name is Rebecca, and she has 30 years of experience working with people that have autism. She has a teaching degree in special education and has worked for many years as an autism spectrum disorder specialist, working at multiple schools. She also has a fantastic podcast that Olivia and I love called Be Calm on Ahway Island. Her amazing podcast has wonderful stories and meditations and is great for bedtime, nap time, or anytime you are looking to relax. Take it away, Olivia.
Thank you, Rebecca, for joining the podcast. How did you decide to work with people with autism?
The short answer is I enjoy being around people with autism, and I find them to be honest and straightforward. People with autism allow me to notice the little assumptions that I make on a regular basis when communicating, and they help me see the world differently. And I really appreciate the fact that they give me a different view of the world and kind of open up my world. I hope I'm as helpful to them as they are to me. The longer answer is my older sister has Down syndrome, and so I have always been working with the special needs community. And through that volunteering, I started working with people with autism. And as I worked with them, I realized how much I enjoyed working with them. And so that's when I kind of moved into it. I just began to appreciate them more and more. And again, I hope that I'm able to open their world a little bit, just as they are opening mine. I always find there's always something new to learn, and I'm grateful for it.
How is being friends with someone with autism different?
I think the biggest difference is that you need to be direct with your requests and expectations, since it can be difficult for your friend with autism to guess what you want. You also need to be patient. They may have some quirks or repetitive behaviors that help them in stressful situations. And also Please be aware if you are using any expressions like it's raining cats and dogs that may be confusing. You may have to explain stuff. So be prepared to explain things, and they will be happy to learn or understand how you are saying things. Just like I said about how I enjoyed having my world opened. That's another. Be prepared to let them see how you see things and share their experience, because it's wonderful to be able to learn more about each other.
What are sensory sensitivities, and what is the best way to overcome them?
Sensory sensitivities deal with our senses. So if you think about sight, hearing, smell, taste, touch, those are all the areas where someone with autism may either be a little more sensitive than you or less sensitive than you. And even a combination of both. So the same person could be more sensitive to sound than you and less sensitive to smells, or vice versa. So another example might be if a person with autism is highly sensitive to sound, you might consider it a perfectly normal or quiet environment, and they are saying, "Why are you yelling at me?" So you feel like you're just talking, but that amount of volume could feel to them like their ears are hurting. In another way, if they have difficulty with sensing touch, they might break delicate items as they grab them because they don't realize how much pressure they're putting on that item. So it's kind of a learning factor where they have to learn how to decrease the amount of pressure they put on, and vice versa. You could be trying to talk to them, and you might think that they're ignoring you, but actually what's happening is they need more sound in order to kind of process it and realize that you're saying something. So it's not that they're ignoring you, they just aren't necessarily hearing you yet. And the opposite, if we do touch again, it could be that you just tap them on the back and they say, "You're hurting me." And they really could feel like they're hurting. So the biggest thing with sensory sensitivities is to listen. Most of the time, that's the best thing you can do is listen to what they're saying. And then we kind of go from there. In some cases, like if it's sensitive to sound, something like headphones or earplugs help. Touch, it could be the clothes they wear, smell. There's all sorts of different things you can do depending on what's going. But I think, first of all, you should never touch anyone with autism without their permission. That will help a lot of misunderstandings. And so that's one rule there. And then the other thing is you just plan for a way for them to take a break. So if they have difficulty with sound, they just need to know where they can go. If they're visiting you, is there a quiet space they can go, and then that they're just taking a break, and you let them have that quiet time to kind of reset and get back into it. That's probably the best thing to be able to do, is just make sure that no matter where you're going, or hopefully the adults will help you figure this out. Where's a good quiet place that they can reset and come back together. And if you have planned an outing and you can't do everything that time, it may be helpful, just be flexible. It's better to have a good time and end it early than push through all your plans and have everybody kind of miserable. So sometimes that's hard for all of us to remember. We want to do what we want to do sometimes, but you got to take a break. So that's probably the biggest thing to remember, is it's always great to take a break, and everybody does well with a break. So I hope that helps with that, because that's a pretty complicated question with so many different ways you can go.
What are some examples of repetitive behaviors, and can they be harmful to someone with autism?
Okay, so your most common repetitive behaviors are harmless. Things like rocking as they're sitting or standing, maybe hand flapping, fluttering the fingers in front of the eyes, and repeating phrases from a favorite movie. So these are all ways that they may be self-soothing or communicating with you. So pretty harmless. You can just kind of let it be. Unfortunately, some people with autism may bang their heads against the wall or bite themselves or pick at their skin. These repetitive behaviors are harmful. It's not very common. It's occasional. But if you should run into someone who that's their repetitive behavior, you'll need an adult to help you. And you yourself should not be trying to get them to stop. Hopefully, like we talked about in the previous question about taking a break, hopefully there's an established way for them to have a break, and the adult will help them get to that point. But if they are self-harming, you don't want to be in the middle of that. So again, it's most likely they're trying to soothe from a stressful situation. So a little patience and caring is important, but definitely have an adult help with that one. So, and again, that's more rare. Most of the time, you're just going to see the flapping and the rocking and the and maybe the hand fluttering. Those are really, and the repetitive, saying the same phrase over and over. Those are really the things that you're most likely to come in contact with, and they're not harmful. So thanks for having me, and I look forward to hearing more from you. Okay. Thanks, Olivia.
Wow, that was fantastic. A big, big thank you to Rebecca for joining us to answer a few questions about autism. It means the world to us. Please check out her podcast, Be Calm on Ahway Island. You can find a link in the show notes. Olivia, before we wrap this episode up, let's answer the question of the week. Who is Satoshi Tajiri?
He is the man who created Pokemon, and he has autism.
That's awesome. Pokemon is so popular. As a child, Satoshi was fascinated with bugs. He turned it into a hobby and started to collect insects. This gave him the idea to create a world where people can catch and collect creatures. What an amazing story. Well, that's a wrap for this week's episode.
Thanks so much for listening to this week's podcast, number 96, on autism.
Great job, Olivia. Before we get to our big announcement, let's reveal the next letter in our super secret code.
The letter is H, as in hippopotamus.
That's H, as in hippopotamus. As a reminder, we have been revealing letters at the end of each episode, starting in episode 90. Those letters are going to spell out our secret code. If you email the code to us before the season finale, you will have the chance to win something awesome. We are going to give you another chance to win by revealing another city that loves listening to the Curious Kid podcast.
Thank you, Urbandale, Iowa.
Thank you so much, Urbandale, Iowa, for listening to the podcast and for all your support. If you listen to us from Urbandale, send us an email with a picture showing your Urbandale pride. If you send us an email, we will give you access to an upcoming episode before anyone else gets to hear it. One of you will even get something awesome from us in the mail. Here comes the big announcement. Olivia just stepped out of the room, so I can tell you now. We could use your help. As you know, episode 100 is just 1 month away. I want to do something special for Olivia for being such a great podcast host. We started this podcast when she was just 4 years old, and she works so hard every week to help me put these episodes together. This is what I want to do. I want to put together a bunch of messages from our amazing listeners and play them for her at the end of episode 100. If you love Curious Kid Podcast, please leave a voicemail for us by calling 856-425-2324. In your message, you can tell us that you love the podcast. You can tell us what your favorite part is. Some people love the theme music, or the long hello, or mailbag, or the question of the week. You can tell us which episodes have been your favorite. You can tell us your favorite fact from the podcast. You can tell us when you like listening to the podcast. Tell us whatever you want, but please leave us a voicemail. It would really help Olivia feel so special. Again, the number is 856-425-2324. I can't wait to hear your wonderful messages. We will be back next week with more curiosity. As always, thank you so much for listening and getting curious with us.